Assalamu alaikum. My name is Dr. Nadeem Akhtar, and I would like to begin by wishing all the Muslim community Ramadan Mubarak. And I pray we are all able to achieve a spiritually fulfilling and rewarding Ramadan. You will be pleased to know this year mosques will be open to allow prayer during Ramadan, but it is essential we recognize the dangers of COVID 19 remain within our community. Hence, it is a priority that we all follow the government guidelines while attending the mosque during Ramadan. In particular, when attending the mosque for prayers, all attendees must wear a face mask. All attendees should bring with them a prayer mat and a bag to store their shoes in. When attending the mosques, we need to ensure we maintain social distancing measures and remain 2 meters apart and only pray in the allocated prayer spaces. Finally, if an attendee develops symptoms of COVID 19, the attendee must self isolate and have a COVID 19 PCR test done. Many people will be aware that an individual can have the COVID 19 infection without displaying any symptoms. Unfortunately, in such a situation, one can spread the COVID 19 infection without being aware of this. Therefore, to protect the attendees at the mosque from such a situation, all attendees to the mosque will be provided with a lateral flow test kit. Within this test kit, the attendee will have all the necessary tests to be able to test twice a week during Ramadan to ensure no one attending the mosque has the COVID 19 infection without realizing. The test kit includes a test tube, buffer solution for the test, swabs to take a sample, bags to dispose of the swab once they have been used, and the lateral flow test kit. The process for the test is simple. Firstly, place the test tube in this test tube holder which comes within the kit. Next, you get the buffer solution, you open the buffer solution and you put this buffer solution into the test tube. After this, you get a swab. You open the swab and you can take this swab and use it to get a sample from the throat and also inside the nose. Once the sample's been obtained, you put the swab into the buffer solution. Instructions on how to take the sample both from the throat and the nose are available within the instructions that come with the kit. Please familiarize yourself with these when you are taking the sample. Once the swab has been placed in the buffer solution, this should be swirled and this swab can then be disposed of within this bag and put in the waste. You can then close the test tube and use this buffer solution and apply 2 drops onto this window which says S, which stands for sample, and you apply 2 drops of your sample into this window. Once the drops have been applied, this test can be put down and you need to wait 30 minutes for the test to process, and you can come back and have a look at your result after 30 minutes. After 30 minutes, if you return to your lateral flow test, you will see some lines appear on the test. For this test I've just done for myself, I can see there's one line next to the C. This is the control line, and if there's only one line next to the control on the control line, this suggests this is a negative COVID 19 test and you do not have COVID 19. If there are 2 lines, 2 red lines on the lateral flow test, one next to the C, the control line, and also a line next to the T, the test line. If both these lines are present, this suggests that you unfortunately have the COVID 19 infection. You must self isolate and arrange for a COVID 19 PCR test to be done. If there's only one line next to the test line and no control line, this suggests that the test is invalid and it must be repeated. Finally, once the test has been complete and you've seen your results, you must record your results. Now, this can be done in three ways. You can either scan the barcode on the lateral flow test and using your mobile phone, and this will allow you to report your result. You can go onto the government COVID-19 website and report your result through the website, or phone 119 and they will register your result for you. Once again, I would request all mosque attendees to ensure you are following all COVID-19 government guidelines, and also to do a twice weekly lateral flow test to ensure we keep each other safe from the dangers of COVID-19 and prevent spread. This will allow us to continue to keep mosques open, ensuring we can continue to pray in mosques during Ramadan. Thank you. Stay safe.